Hi friends, I am Dr.Anshul Bansal again on this Unacademy platform. In today's YouTube live session, we'll read about the X-rays of the upper limb. So it's basically a revision type of session, very interesting and very high yielding, in which we'll study upper limb orthopedics with the help of the X-rays. Okay. Currently, I am working as an orthopedic house surgeon in SMS Medical College, Jaipur, and I have cracked the same NEET PG exam last year, that is in 2020 only. Okay, we'll study here about in-depth orthopedics that will not only help you in your NEET PG, INI-CET type of exams, but also in your prof or university examination. And also we'll give more emphasis on the clinical and imaged and x-ray based questions and the x-ray based learning, so that it will be helpful for your coming next exams also. Okay, so let's start today's session. Let's crack NEET PG. Okay, so in Unacademy for NEET PG, we have two types of subscriptions. One is the plus subscription. In plus subscription, you'll get daily live classes and daily live tests and quizzes. Plus, you'll get the structured course. Courses are structured in a strategic manner and in a very simplified form, so that you can learn the basic concepts first. And you will also get the unlimited access to all our QBanks, recorded live and past live sessions, all of it. Okay, and the second is the iconic subscription. In iconic subscription, you get the prep ladder, in which you'll get all of its video lectures and QBanks and rapid revision courses. And apart from the things that I have told you earlier, in Unacademy you will get extra live batch wise classes, okay, and the printed notes of the sessions of the educators, as well as you will get live tests and quizzes, and we'll provide you with an individual assessment of every test, so that you can see where you are lacking behind and which topics you need to learn more and cover more. Okay, so for the this plus and iconic subscription, you can use this code to get extra 10% off. Okay, not only on NEET PG, you can use this code for enrolling in any other courses like UPSC or your board examinations, etc. As you all know, the NEET PG examination for 2021 is scheduled in September only, so less than 2 months are left. So we have started our rapid revision courses in the NEET for NEET PG, and also for NEET PG 21 we have started a integrated clinical batch, so you can enroll for this and use this code to get extra 10% off. Keeping in mind the coming next pattern, and for our MBBS students, we have started a 3-year batch program. Okay, so you can enroll for this and use this referral code to get 10% extra off. Keeping in mind the FMG examination, we have started a special batch for FMG students, okay, from 21st of the July, and you can enroll in this and you can use this code to get extra 10% off. We are running a limited time period offer, in which if you will buy any of a subscription of 12 months, you will get extra 2 months of it free and extra 10% off if you will use this code. Okay, we are also having a limited time period offers for our iconic subscribers. Earlier, for 3 years, it was used to be 92,000. Okay, now the cost is 58,500 only in this limited time period offer, and you can get extra 10% off on using this code. So please hurry up. Okay, and I would like to suggest to go for the plan with longer duration, because as you can see, as you increase the duration of your course, the the cost per month decreases significantly. Okay, and please go and download the Unacademy app and subscribe. Both of are free, and only the subscribed users will get entry to a special classes on the app. And in special classes you will get a live classroom like feel. Okay, it will be a very interactive session where we go for the polls for the learners, as well as you can raise your hand and you can ask and clear your doubts there and there only. You don't need to wait for the reply of the educator. Okay, and you'll never miss a class. Obviously we'll notify you time again and again for the classes. You will get the notes, printed notes of the lectures, as well as the best part is you can see the lectures anywhere and anytime. You just need to open your app. Okay, and also we are running a special bugs bounty program, in which if you find any inappropriate contents in any of our educators contents, then you can contact our team. The link is below, and if that is found correct, you can win exciting prizes. Okay, so let's start today's lecture. As I have mentioned earlier, आज हम क्या पढ़ेंगे? We'll study about upper limb orthopedics with the use of X-rays. Okay, so let's crack NEET PG. So this is a normal X-ray of shoulder joint. Okay, so see what it is. This is humerus. Okay, change the, this is the humerus, this is the scapula, this is the clavicle and scapula, this is the glenoid cavity of the scapula, this is the coracoid process of the scapula, this is the acromion process of the scapula, and here clavicle attaches with acromion process, clavicoacromial joint, and here clavicle acromial ligaments are also present. Okay, and here we have the coracoacromial ligaments also. Okay, this is the head of the humerus. Here this is GT, and below GT, sorry, this is GT, and this is LT. More higher and more anterolateral will be GT. Okay, and here this is the anatomical neck. Okay, and this is the surgical neck. Okay, so surgical neck is the most common site for fracture as compared to anatomical neck. Okay, and the axillary nerve also winds out around this part. On the posterior aspect of the humerus, you have a groove which is called as the radial groove, in which radial nerve passes. Okay, so this is a normal shoulder joint X-ray. See, this is elbow joint, this is humerus, distal part of the humerus. Okay, this is radius, this is ulna. So this will be the medial side and this will be the lateral side. Here you can see it is the olecranon of the ulna. Okay, this is the head of the radius, this is the neck of the radius. Okay, this is the lateral epicondyle, this is the medial epicondyle. Okay, and you know there is a bony point relationship here. There's a bony point relationship here. Okay, two epicondyles and this olecranon tip. If in a flexed elbow, if you will join this, it will make an isosceles triangle. Okay, these are the two condyles, and here this part of the humerus, this part of the humerus is called as, this part of the humerus is called as the capitulum. Okay, and this part of the humerus here it is called as trochlea. Okay, so this is the AP view, this is the lateral view. Here you can see this is the humerus. Okay, this is the olecranon, this is the tip of olecranon. Okay, and this is, sorry, ulna, this is radius, this is head of the radius. Okay, this is the elbow joint. Now see, this is a normal wrist joint. Okay, this is the inferior radioulnar joint and the wrist joint. This is radius, this is ulna. Okay, this is your first finger of first metacarpal, second, third, fourth, and fifth. Okay, no, sorry, extremely sorry, let me erase it. This is, sorry, this is your ulna. Okay, and this is your radius. Okay, this is your ulna, this is your radius, so this will be your first finger or the thumb, second, third, fourth, and fifth. Okay, the broader part नीचे, this will be your radius. ठीक है, ऐसे याद रख सकते हो कि अल्ना एल्बो जॉइंट पे ब्रॉड होती है एंड रेडियस रिस्ट जॉइंट पे ब्रॉड होती है. ओके, दिस इज योर styloid process of ulna and this is the styloid process of the radius, and here are the carpals, and in carpals को याद रखने का भी I have told you one mnemonic. See, first divide them into two rows like this. Okay, and if we go from lateral to medial, that is from radius to ulna, 1 2 3 4 5 6 7 and 8. Okay, 1 2 3 4 5 6 7 and 8. Okay, so which are these? There's one mnemonic: some lovers try positions that they can't handle. Okay, so first will be scaphoid, most important. Second will be lunate. Third will be triquetral. Fourth will be pisiform. Okay, fifth will be trapezium. Sixth will be trapezoid. Eighth will be capitate and hamate. Okay, so this is the normal radioulnar joint. Okay, now what is this fracture? Can anybody tell me what is this fracture? I'll give you 5 seconds if you can reply. If anybody knows, they can type on the live chat box, or if they have any query, they can also type it in the live chat box. I'll try to solve them there and here only. Okay, so this is fracture of scaphoid. Okay, so काम की चीज क्या है इसमें? First of all, most common fracture of carpal bones. Okay, most common complication is avian and very important complication. Okay, not readily noticed. Okay, and we require a oblique view. There is a special cast called a scaphoid cast or glass holding cast. It is like this in the glass holding with with palmar flexion and slight radial deviation. Okay, and slight radius deviation, and with palmar flexion and ulnar deviation we put police cast. Okay, most common site of fracture is its waist or middle 1/3, and most common site for AVN is proximal 1/3. Okay, and its distal 1/3 is called as the scaphoid tubercle. Its distal 1/3 is called as the scaphoid tubercle. Okay. Now next, what is this? We have discussed it in earlier slides. It is of lower limb, obviously. What is this? 5 seconds. Okay, this is femur, this is tibia, this is fibula, and this is Brody's abscess. As we have discussed, it is a localized abscess due to the strong defense mechanism of the bone. It ये bone के ही एक part में concise होके रह जाता है. And see, there is a sclerotic part here. There is sclerosis around it, and similarly it is GCT, but GCT you will get soap bubble appearance. The margins will not be sclerotic. Okay, the treatment of Brody's abscess is you have to drain, you have to do sequestrectomy. जो sequestrum part है, जो dead part है bone का, you have to remove that, and you have to send these sample for culture sensitivity and other investigations, and you have to give antibiotics for around 4 to 6 weeks. Okay, and what is the treatment of GCT? In GCT we go for curettage and excision, and if the defect in the bone is large, you have to fill this excision site with bone cement and send the excised tissue for histopath examination or biopsy. Okay. Now, what is this? This is sternoclavicular dislocation. Okay, here you can see. Okay, and how will you see it? There will be a localized swelling and tenderness at the area of the injury, so you can easily correlate the clinical findings with the findings of the X-ray and the history of the patient. Okay, now next, what is this? This is fracture proximal humerus. Okay, and there was one important classification in the fracture of proximal humerus, and what was this? That was NEET classification, in which it was of 4 types. There are 4 major things. One is the greater tuberosity, the second is the lesser tuberosity. Okay, greater tuberosity. Okay, here we can't appreciate it. Okay, so there are 4 things, and अगर चारों का fracture हो जाए तो that was the 4 type 4 part, और 3 का हो तो that was the 3 part fracture. Okay, so that was the NEET classification. Just remember the name. Okay, now ये किसका fracture है? Which fracture? This is fracture of greater tuberosity of humerus, and generally it is displaced by the pull of which muscle? I have told you, it is displaced by the pull of supraspinatus muscle. Okay, it is displaced by the pull of supraspinatus muscle. Now this is fracture shaft of humerus. This is a oblique spiral fracture. Okay, shaft of humerus, and there is this lateral angulation most commonly and very commonly in such fracture, and it is because of which pull of which muscle? It is due to pull of deltoid muscle. Okay, it is because of the pull of deltoid muscle. Okay, and most common nerve injured here is the radial nerve. Okay, and that too most commonly radial nerve is injured at the junction of distal 1/3 and middle 1/3, and it is known as Holston-Lewis fracture. Okay, it is known as Holston-Lewis fracture. What is this? This is a dislocated right shoulder. Okay, here you can see the humerus head is out of the glenoid cavity. Okay, this is humerus fracture. Okay, and this is of which type? This is anterior. This is also dislocation of shoulder joint. This is inferior dislocation, and there is a special name of this inferior dislocation, and it is luxatio erecta. Okay. Yeah. Okay. Which fracture is this? This is supracondylar fracture of humerus. Okay, in you can see दोनों condyles के ऊपर से fracture है. ठीक है. This is the most common elbow fracture, especially in children, and it is a very serious fracture due to vessels and nerve injury involved. Okay, vessel is brachial artery most commonly, and nerve is most commonly median nerve, followed by radial nerve. And medial nerve you have, in radial nerve palsy you have wrist drop, and median nerve, which palsy do you have? आज ही पढ़ाया अपन ने. Okay, कौन सी palsy होगी? Anybody? I am giving you 5 seconds for it. Okay, in median nerve you have ape, thumb and all. Okay, so this is about the supracondylar. And one more thing, there is a specific classification of supracondylar fracture of the humerus. And what is this? It is Gartland's classification. It is Gartland's classification. Okay, it is of 3 types. And one more thing, yes, most common complication, it is a delayed complication, and it is cubitus varus. Okay, in which you will have gun stock deformity. You will have gun stock deformity. Okay, in cubitus varus the carrying angle decreases. What is carrying angle? ह्यूमरस के लॉन्ग एक्सिस और अल्ना के लॉन्ग एक्सिस के बीच में जो ये एंगल बनता है, दैट इज कॉल्ड एज द कैरिंग एंगल. ओके, in the previous slide we were discussing about shoulder dislocation. So what is most common shoulder dislocation? Anterior, then posterior, then inferior. And posterior shoulder dislocation occurs due to epilepsy in epileptic patients and electric shock. Okay, and if the dislocation is anterior, and anterior dislocation, how will the shoulder joint be presented? Okay, in anterior dislocation the shoulder joint will be like this. It will be abducted. Which fracture is this? Okay, this is fracture medial condyle of humerus. Okay, common in children. And if there is displacement like this, you have to fix it either by closed reduction and then percutaneous K-wire, or you have to go for or if open reduction and internal fixation, or you have to go for open reduction and internal fixation. Okay. Okay, which fracture is this? This is fracture oligrenon of ulna, and if it is not displaced or not commutated, you can go for conservative management by slab. And ध्यान रखना 90-degree flexion of elbow में slab नहीं लगती इसमें. Here we give slab sorry, we give slab for at 30 to 40-degree flexion. Okay. And if there is distraction or combination, you have to go for surgery, and surgery here is TBW, tension band wiring. It is done majorly at three parts of the body. TBW, first is the oligrenon, second is the patella, and third is the medial malleoli. Okay. Now, which fracture is this? Okay, very important and discussed many a times. This is Monteggia fracture. This is Monteggia fracture. Monteggia से मेरे को याद आया. What is Malgagny's fracture? Malgagny's fracture is fracture supracondylar humerus. Okay, and Monteggia fracture is fracture of proximal 1/3 ulna with dislocation of radius head, and it is of two types, extension and flexion. Extension is commoner than flexion, in which this angulation as well as this dislocation will be anterior. Okay, and supracondylar humerus fracture is also of two types, extension and flexion, and extension is commoner, and in extension the displacement will be posteriorly. Okay, now इसका opposite जो होता है that is Galeazzi. Not opposite means counterpart sort of. तो GRD से याद रखना है. GRD Galeazzi means distal 1/3 radius fracture with dislocation of the distal radioulnar joint, and it is fixed by ORIF, in which you do plating at the ulna, the radius, and you fix the radioulnar joint with K wire. Okay, this is Galeazzi fracture. Okay, now which fracture is this? This is fracture of distal end of the radius. Okay, and see, it is not intra-articular, it is extra-articular, and the distal fragment, it is dislocated in this, and this is your dorsal side. So this will be Cooley's fracture. So Cooley's में you have to याद C के बाद D आता है. So dorsal till है ना, dinner fork deformity, very important. Extend, fall on an outstretched hand. In elderly population, especially in women after the menopause. Okay, so you have to keep in mind about the Cooley's fracture, and its opposite will be the Smith fracture, in which it will be also extra articular, but the displacement or deviation of the distal fragment will be anterior. Okay, this will be the Smith fracture, and if it is intra-articular fracture of the distal end of the radius, it intra-articular associated with carpal bones and its dislocation. Okay, with dislocation of the distal radioulnar joint, it will be Barton's fracture, and most commonly the displacement of the distal fragment is anteriorly, and anterior is volar side, so it is called as the volar Barton fracture. Okay, what is this? This is lunate dislocation, as you can see, and here this empty sign is called as the Terry Thomas sign. Okay, and there are two type of dislocations, lunate and perilunate. In lunate is dislocated and rest all carpal bones are in normal anatomical position, and iska ulta perilunate, in which lunate will be in normal position and rest all carpal bones will be dislocated. Okay, this is which fracture? What is the name of this fracture? It is boxer's fracture, fracture of fifth metacarpal neck with anterior displacement of the fracture segment. Okay, this is boxer's fracture. Now, this is which fracture? This is Ronaldo's fracture. Base, see, base of first metacarpal or thumb पे. There are two types of fractures. One is Bennett's and one is Ronaldo. Ronaldo is extra-articular. Bennett's is intra-articular with displacement of this carpo-metacarpal joint. Okay, what is this? This is Skyer's thumb or gamekeeper's thumb, in which thumb यानी first metacarpophalangeal joint पे there is forceful abduction, due to which there is tear of ulnar collateral ligament, and sometimes it takes a chip of the bone with it. This is called Skyer's thumb. Okay, this is Skyer's thumb. Now, what is this? This is Masoni's fracture, fracture of neck of fibula. Okay, this is Phelan fracture, fracture of the distal elbow, sorry, distal ankle, and especially distal tibia with comminution. Okay, this is all comminuted. This is Jones fracture, fracture of base of fifth metatarsal. This is a chance fracture, fracture of vertebral column. Okay, एंड दिस इज स्ट्रेस फ्रैक्चर का एक टाइप होता है मार्च फ्रैक्चर, सेकेंड और थर्ड मेटाटार्सल में होता है. We have discussed all these slides in numerous time in questions. This is burst fracture or committed compressed fracture of the vertebrae. What is this? This is torus fracture seen in children. Okay, and it is at the junction of metaphysis and diaphysis, managed conservatively. And this is again fracture in children, and this is green stick fracture. It is unicortical and incomplete, and there is bowing, managed conservatively. Okay, now what is this? This is cross union of radius and ulna. Okay, when both bones are fractured together, sometimes there is a condition in which callus formation occurs in such a way that there is cross union, and most common cause for this is when you open the ulna and radius during the operation through the same incision. So that's why ulna and radius को fix करने के लिए during surgery you open them from different sides. Okay, firstly you open radius, and radius is deep seated. It is open from the anterior aspect, and ulna, it is sort of percutaneous only, not very deep, so it is open from the posterior aspect. Okay, now which fracture is this? This is fracture of radial styloid, and obviously as you can see this is intra-articular, but there is a special name given to this fracture. Okay, and what is this? This is also called as Scaphoid's fracture. Okay, this is Scaphoid fracture of talus. Okay, and as you can see this is fracture clavicle. Okay, most common site of fracture of clavicle is at the junction of outer 1/3 and the middle 1/3, and mostly this outer segment is displaced medially and downwards, and the medial segment is displaced upwards due to pull of which muscle? Okay, any guesses? We have discussed this already. So this downward pull is due to pectoralis major muscle, and this upward pull is due to sternocleidomastoid muscle. Okay, now what is the pathology here? What is the pathology here? Okay. This is Banker's lesion. Okay, in dislocation of the shoulder, okay, sometimes the glenoid labrum that forms this rim type of thing around the glenoid cavity to make it more deeper. So during dislocation, sometimes the glenoid labrum is displaced or is torn at the anterior lateral aspect, and with it sometimes a chip of the glenoid cavity also gets fractured and displaced. So this is Banker's lesion, and similarly posterior lateral aspect of the head base, sometimes there is this lesion which is formed here. in dislocation of the shoulder only. This is called as Hill-Sachs lesion. Okay, see, 1, 2, and 3. What are these fractures? What are these in head? This shows elbow dislocation, and this is fracture of coronoid process of ulna, and all these three comprise and they form the terrible triad of elbow. Okay, and it is highly unstable fracture, and it has to be, firstly the shoulder joint, the elbow joint has to be relocated, and the fractures need to be fixed. Okay, now this is segmental fracture. Okay, more than one fracture lines and segments in the bone. This is, इसमें आपको क्या दिख रहा है? इसमें आपको दिख रहा है टुकड़े. So this is comminuted fracture. Both are fracture of shaft of femur. This is a transverse fracture. Transverse fracture line है एकदम, and this is more of an oblique fracture. Okay, and which fractures are easy to heal? These are easy to heal because more surface area मिल जाता है. Okay, now what is this fracture? This is fracture of tibial spine, and always go for the MRI in fracture of tibial spine because there is almost always associated injury of cruciate ligaments. Okay, what is this fracture? This is volar Barton fracture. Okay, intra-articular with carpal and anterior dislocation of the distal fragment. Okay, this is bimalleolar fracture of ankle. See, medial and lateral malleoli, two are fractured. This is called as Pott's ankle, and here you can see 1, 2 malleoli, and this is the posterior third malleoli. This is trimalleolar, and this is called as Orton's fracture. Okay, so I have tried to revise the upper limb orthopedics through fractures. All the most of the things that can be covered through fractures. Okay, these are very high yielding and very easy and interesting also. Okay, so we have almost covered the upper limb. Some classes of the upper limb are not on the YouTube because they are on the special class. So please kindly watch them, they are very good. For this you have to subscribe, which is absolutely free, and you have to download the Unacademy app. I am scheduling a special class session where I will be revising and teaching the entire upper limb orthopedics in just 90 minutes. Okay, it is scheduled tomorrow at 10 p.m. as special class, so please subscribe and download the Unacademy app. And for paid subscription you can always use this code. I hope you liked the video of today. I have taken it jaldi because it was more of a revision kind of thing. So you should revise. ओके। एंड जितना हो सके इमेज बेस्ड क्वेश्चंस के थ्रू या इमेजेस के थ्रू या टेबुलर फॉर्म और फ्लो चार्ट के फॉर्म में रिवाइज। ओके। एंड वन थिंग, वन एक्सपीरियंस ऑफ माइंड जो मेरे साथ हमेशा ही होता था, दैट वाज कि whenever I used to revise it was like यार ये मेरे को तो याद ही नहीं था, एंड ये तो मैंने अभी पढ़ा था, है ना, I have studied it just few days ago and I don't remember it, but don't worry, it happens with everyone, है ना. But if the question regarding that comes, so you'll get in your mind and options देख के you'll get an idea. Okay, so don't worry, just read, do more and more question practice. Okay, and if you have any doubt you can anytime contact. Okay, so thanks for watching. I hope you liked, and if you like this video, please like, share and subscribe and press the bell icon. Okay, and for the paid subscription you can use this code. So see you tomorrow in the special class. Thanks for watching.